Welcome to our YouTube channel, where we aim to educate you about all things acupuncture. I am Marika from Natural Solutions Acupuncture, and today we will give you some insights into male fertility. So let's get started. If you and your partner have been trying to conceive with little luck, it's very likely you have been told that the reason for failing is due to female factors. A sperm analysis, however, is a very important part of the puzzle and, even more so, a correct interpretation of it. About 1 in 5 Australian couples have difficulty getting pregnant, and male fertility accounts for approximately 40% of these cases. However, most of these men were informed and like to believe that they have perfectly normal sperm. First of all, what is a sperm test? A sperm test requires the collection of an ejaculation in a sterile plastic jar, which is then examined quickly in the laboratory. It is very important that the examination happens within 2 hours of collection. The sample needs to be collected after 2 days of abstinence, but within 5 days of the previous ejaculation for the most accurate results. The sperm sample is then analysed, and they will be looking at 4 parameters. Firstly, the volume of the sample is important. Second is the sperm count. How many sperm are there actually in the sample? Then they look at the sperm motility. This is the percentage of sperm that moves in the right direction. Lastly, they look at the so-called morphology. How many of the sperm have normal forms? Male fertility has changed a lot over the last few decades. For instance, sperm counts have dropped more than 50%. Yes, you heard that right, they dropped more than 50%. 20 years ago, a sperm count of 100 million per milliliter was considered normal. Now that is reduced to 15 million per milliliter. Most researchers blame this on the change in lifestyle in Western countries. The use of hormone-disrupting chemicals, as in certain foods and cleaning products, smoking, medication and pesticides. Stress and obesity all play a big role. Not only the sperm count is a problem nowadays, the morphology, the size and shape of the sperm has dropped from 30% to a low 4%. Also, the motility, the movement of the sperm, has gone down from 75% to 40%. The rapid decline of sperm in the last few decades means that the reference ranges have been adjusted accordingly. So what is considered good sperm now was probably considered not so good 22 years ago. We have to keep this in mind when we look at your test results. What are good levels of sperm? What numbers do we like to see? A population study looking at men's fertility found that those men that succeeded in conceiving a child had a sperm concentration of more than 48 million sperm per milliliter, a motility of more than 63%, and a morphology of 12%. These levels are considerably higher than the standard reference ranges used nowadays. When it comes to treating fertility in traditional Chinese medicine, we value both partners' contribution, as it takes both an egg and a sperm to make an embryo. Only healthy sperm makes healthy babies. So who will benefit from male fertility treatment? If your sperm numbers are close to or below the reference range, your sperm is suboptimal for fertility. You would definitely benefit from improving your health and sperm. Other health issues that are considered important in reproductive functions are lower back pain, night sweating, a cold to touch penis, digestive problems, using asthma medication, fatigue, and mood problems like depression. If you suffer any of these symptoms, it is also strongly recommended that you come and see us for a formal consultation. I hope that answered some of your questions and gave you a bit of insight. Please like and follow us for more episodes on all things acupuncture. Remember, you are the master of your own health, and we can help you with that.